Hey there, if a birth is in your future, you might be thinking about an epidural. And if you're thinking about an epidural, I'm guessing that you might have been thinking about the benefits versus the risks. And this is something that as a doula, I always like to help my clients think through benefits versus risks and what makes sense for them and their own labor. So this is not the first time I started this video. This is actually a couple times in, and I realized that it's a lot of data to try to put together. And so this time we're going to use my handy notebook and we're going to lay out benefits versus risks. Let's do it. So before I dive into the real details, I just want to say that this is not meant to sell you on getting an epidural or dissuade you from getting an epidural. I actually think an epidural is a wonderful tool to have in our toolbox. That's something that some people choose to use the tool or they need to use the tool, and some people avoid it altogether. So there's no one right choice. This information hopefully will help you make the decision that's right for you and your labor. Let's start off with the benefits. Really, if you ask anyone, ask the care providers out there, midwives, doctors, even people who have had epidurals, there will be a lot of agreement that best pharmacologic way to decrease or eliminate pain in most cases. Number 2, they have no effect on your brain, which means that you are still clear-headed after you have an epidural. This is a benefit, real big benefit for a lot of people who don't like that fuzzy-headed feeling that maybe an IV narcotic or nitrous oxide might give, that the epidural does not have any effect on that mental clarity. Number 3 is one of my favorite benefits of an epidural, and that means that it can allow for rest. So by eliminating pain in most cases, you have the ability to rest. And rest sometimes can be the main thing that's needed in labor and can be very hard with any other type of pain relief. But rest is so important when you get an epidural. And the 4th one is that most experts agree that an epidural is very safe for the baby. So most experts say that the epidural medication does not cross the placenta and usually does not have an effect on the baby. So 4 big benefits of the epidural. Now we got to jump right into risks, and let's start with itchiness. So people that have epidurals sometimes experience itchiness. There is definitely limited mobility, of course, because you are feeling numb. Now, this isn't necessarily a risk for if labor is going well, but can be a risk for the ability to move around the way the body needs in labor. This next one, you might have hot spots or breakthrough points. So there might be areas that just don't have proper coverage. You might be feeling the contractions at one area. Also, you have an increased need for a urinary catheter, and then having the urinary catheter can increase a risk of a UTI, a urinary tract infection. Getting an epidural has a risk of slowing down your labor, and that may lead to the need for artificial rupture of your membranes, breaking your water, and it might lead to a need for Pitocin. Again, you're hearing me say the word may, you're hearing me say the word might. So these aren't all necessities. These are things that increases a risk for these, that an epidural increases the risk for these possibilities. Next one is a decrease in maternal blood pressure. So if there is a decrease in maternal blood pressure, it may lead to nausea, the need for additional fluids, the need for medication to speed up your heart rate to increase that blood pressure. It might lead to a decrease in oxygenation for the baby. And if this is severe enough that can't be resolved, it might lead to a need for a cesarean birth. The next one, a longer pushing stage, which if that happens, it may lead to the need for vacuum or forceps and assisted delivery, and that may lead to an increased risk for perineal tears. Then there is also a risk of a maternal fever, and with maternal fever, that may lead to a need for antibiotics. Now, finally, there are a few that are rare, but I wanted to go ahead and mention, and that is anytime there is a puncture of the skin, there's a risk of infection at the site. There's also a risk of a spinal headache if the catheter was placed in the incorrect space. And there is a risk of local nerve damage to the area where the epidural was placed. Again, these are 3 rare risks. So we've got our benefits, we have our risks. Clearly, they look different, right? Our benefits are fewer and our risks are more, but as you guys noticed, that the risks are maybes, they're not definites, and the benefits are pretty definite. I would say with the first, as the best form of pain relief is the one that could be a little bit of a maybe. Not always do you have great pain relief, but the benefits are pretty, most people experience a lot of these benefits. Whereas the risks, I would say, they are kind of experienced differently for different people. So what do you think? Did it spell it out all together? I hope that seeing this visual is a way to help you process the information and make the right choice for you. Now, I have a great video about how to have the best epidural possible. That's some really good tips right here. I suggest going there and checking that out. And if you haven't subscribed, make sure to hit that button so you can find out when the next video is posted. See you guys next time. Bye.